Hi, I'm Dr. Anju Pabby, and on behalf of DC Derm Docs, Dr. Isaacson, Dr. Burzin, and myself, I welcome you to our RHA filler event. We encourage all attendees to stay till the end of the event, as you will be given the opportunity to submit your questions via the question tab. In addition, all attendees who remain at the conclusion of the event, we will email you a 10% off discount certificate to be applied to your next RHA filler and neuromodulator appointment. At DC Derm Docs, we have decided to bring in the Revance RHA products to fulfill a desire of our patients to look more natural and not filled. So we have chosen RHA Revance products as they flow very well with our movements of facial expression. In addition, they last longer than other fillers, hyaluronic acid fillers in the market, adding an additional benefit to our patients. Revance RHA fillers are the only FDA-approved hyaluronic acid fillers for dynamic lines and wrinkles. Those are the wrinkles and lines that we have when we use our muscles of facial expression. RHA fillers most resemble our own body's hyaluronic acid structure, as it has the least amount of chemical modifications as compared to any other hyaluronic acid filler available on the market. RHA fillers integrate well into the skin and move naturally as we use our muscles of facial expression. This is opposite of what we experience with other fillers that sit there and do not move at ease with facial expression. This allows for beauty at rest and flawless in motion. RHA Revance fillers tend to last 15 months, which is 3 to 4 months more than other hyaluronic acid fillers available in the market. However, we have some patients that still look good after 2 years. The beauty of RHA Revance products is that anyone is a patient. Anyone who wants to have a natural and not overfilled look would do well with this product. We here at DC Derm Docs have patients that range from age 30 to age 70. RHA Redensity is my breakthrough product that I refer to as my airbrush filler and works great for perioral lines, necklines, and depression under the eyes. Daxxify is the first and only long-lasting neuromodulator that shows a median duration of 6 months and can be seen to have a result up to 9 months in some patients. Daxxify offers year-round results with as few as 2 treatments per year, which is almost double the duration of other neuromodulators on the market. DC Derm Docs is excited to be one of the first offices to offer Daxxify to our patients.
So when you come in for a consultation in our office, we do evaluate the face. What most people point out when they come in looking for fillers is they point out the nasolabial folds. But the nasolabial folds are just a symptom. They're not the disease. They're not the cause. And what causes these deep nasolabial folds is a loss of volume, a loss of bone, a loss of fat in the cheek and the malar area. And when you lose that subcutaneous volume, the skin that's draping over it no longer has support and it begins to sag. So she used to have more volume back up in here, more bone, that held that cheek up. But now she's lost that subcutaneous support and the skin falls forward, producing these nasolabial folds. Now, if you only had one vial of filler, you could fill these nasolabial folds if that was her main concern, but it looks a little bit funny when you address the symptom and you don't address the disease. So when you put filler just in the central areas of the face, you are projecting out the central portions of the face compared to the lateral portions of the face, which is unnatural. We use fillers to address loss of volume in the face. And when you address that loss of volume, it makes you look more youthful. But what's also important is to address contour and structure of the face, because contour and structure of the face is what makes you look beautiful. So volume gives you a more youthful appearance, but structure and contour give you a more beautiful appearance. So when we go ahead and take a look at her face, we have to go ahead and address the issue. So first of all, she's losing volume up here in the temple area. And when you lose volume in the temple area, you lose support to your lateral eyebrow and it falls down. So by putting volume in the temple area, we can lift that lateral eyebrow up, okay? And when we fill the temple area, it also affects the cheeks, the nasolabial fold, and the jawline. And so it contours the face and it gives a better shape. Now, also, in a female, the distance of the upper portion of the face in the malar area should be about 10 to 20% wider than at the jawline. And you can see in her that the width of the jawline is wider than the width of her upper face. So to put her back in proper proportions, we need to widen this. So what we've done so far is we just injected half of her face. We injected the right side of her face. And what I did is I used a blended RHA 3, okay, up here into her brow and a little bit in the upper portion of her temple area here to give her a little bit more support to raise her eyebrow up just a little bit. Okay. We used Redensity underneath her eye in the tear trough and in here in the lateral portion. I used RHA 4 to fill in her medial cheek and to come up here and to fill up in her lateral cheek all the way out here, way back into the hairline here, because we wanted to widen that face out. And now you can see before the top portion of her face was narrower than the bottom portion of her face. And now it's wider than the bottom portion of her face. And this in turn lifts everything up. We put a little bit of RHA 3 in her nasolabial fold here. We put some RHA 4 in her jaw angle to bring it back and give her a sharper jaw angle. We use some RHA 3 here along the jawline and in her mental groove here to bring her chin out a little bit. We used RHA 4 in her chin to bring her chin out. And remember, before her chin was behind her lip, and now it's out in front of her lip. So we're changing the structure of her face. And then we use a little bit of RHA 2, very, very superficially in here to go ahead where she was a little bit deficit, and that also lifts up the corners of her mouth. And now she's got a much better shape. These little areas of halos are just where we numbed her for the cannula. They vasoconstrict in the blood vessels, so she has less bleeding. It doesn't hurt when we use the cannulas, and they go away in about 30 minutes. But we've used cannula on her primarily. Nice thing about a cannula is that it doesn't puncture the blood vessels. You can go ahead and address a large area of the face through one puncture wound, and when it hits a blood vessel, instead of puncturing it, it pushes it to the side, so you don't have as much chance of bruising or complications from the fillers, and you can walk out of here and go right about your business, as opposed if you use the needle, you could be bruised and you would have some social downtime. We're going to go ahead and finish up the other portion of your face, and then we'll show you the final product.
Oh wow. Oh wow. There's no bags.
We gave you cheekbones. We got rid of the tear trough, the dark circles underneath your eyes. We raised your brows up. We widened out your cheeks. We filled in your nasolabial folds. We brought your chin out. We gave you a better chin. We filled in some of the hollows around your mouth, and we used all the different products.
Thank you. Oh, this is great. I'm so pleased. This is exactly what I was wanting to get rid of. Like, oh, this is great. Thank you.
Thank you everyone for attending tonight, and we will be emailing the discount certificates to all our attendees for your filler appointment. For those of you who brought a friend, you will be getting an additional $100 gift certificate to apply to a cosmeceutical of your choice after completing your filler appointment. Please check your text after the event and reply back yes to book an appointment for your filler and neuromodulator, and you will be contacted by a member of our team. I invite all of you to submit your questions via the question tab, and our expert panel will do our best to answer them. Thank you.